Good morning. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber. I want to thank you, the audience of business leaders, for committing your time to learning about the procedures for getting your business up and running in a safe manner. We need to get our economy rolling and getting businesses in, but we need to protect public health, and it is critical to achieving our goal. Thank you to the Boulder County Chambers and Economic Development partnership in putting this event together. And we want to thank Boulder County Public Health for hearing our community's interest and working hard to get our businesses open in a safe manner, and for working with us collaboratively to develop safe operating procedures that are sensitive to unique business characteristics. Again, our shared goal is to get businesses up and running, but then keep them up and running and not going backwards. This is for the protection of our businesses, our workforce, and our customers. Please note that some of the practices that you hear about today are mandates from Colorado Department of Public Health and Environment and/or Boulder County Public Health, and they feel these are critical to maintain the safety of our community. I thank them for making adjustments after last week's feedback sessions and for being here today to present the education on what you need for the safer at home practices. At this time, I'm going to introduce Lane Drager of Boulder County Public Health.
Thank you, Corinne, and thank you all for taking time to join us. We have been working really hard to go through the state's information and make sure that we have information for you to be successful as we move into this next phase. So we'll go through our agenda of what we want to cover today. Matt, if you would advance that slide. And thank you to all the folks that helped organize this. This was a monumental effort to get this out to as many people, so we really appreciate that huge partnership. So what we want to focus on today is what's allowed under this next phase, specifically this Safer at Home that goes into effect on May 9th. We want you to be successful and do this safely. Make sure you have all the resources and support that we can provide. We'll also be sharing at a later point some of the questions that we received last week, but we also have some other resources for you related to question and answers, and we will be spending answers you have. So this will give you just a general idea of who we're targeting this webinar this morning for. It's really all those office spaces and the office settings, not so much all the other sort of retail and other practices. We have really tried to break out our sectors, but hopefully this you see something that represents you and that sort of catch all of other professional office spaces. So here's a timeline of kind of where we've been at. We've obviously been under the stay-at-home order. I'm sure for many of you it feels like forever, but we are getting close to moving to this next phase. So the stay-at-home order is in effect until May 9th, and as you may have seen, there's a new order that hopefully is going to help the businesses be more successful in addressing some of those concerns about the public. Related to face coverings. So that goes into effect May 9th. It was signed on the 2nd. And so we will have sort of two orders going into effect on Saturday. The Safer at Home for all the business sectors that are going to be allowed to open, as well as the face covering for those people out in public that are not able to maintain that social distancing. So really, this Safer at Home and potentially future evolutions is going to be where we're at for quite a long time. Really, we won't see any semblance of where we were prior to COVID until we see that significant immunity in our communities. And largely that's a vaccine that's developed and widely available, potentially treatments, but more likely that we're going to need to see a vaccine. So this will be months. It's likely at least a year or so before a vaccine is developed, and maybe even longer before it's widely available. So again, as Corinne mentioned, we really want this next step to be very successful so we can continue to see some loosening of these requirements, but knowing that this disease and the issues in our community are going to likely be around for quite a long time. So again, until we get to May 9th, we're still in our stay-at-home order. So there isn't any changes for the business community allowed until May 9th, with the exception of the provision we added for curbside pickup and delivery for retail. So the face covering order will be going into effect on May 9th, certainly something that people should already be doing proactively, but the effective date of that order is May 9th. And so we're still this week in that preparation phase, making sure everybody has what they needed and have the information that they need to be successful. And now I'm going to turn it over to Matt Hannon. He's going to walk you through the specifics for your sector.
Great, thanks a lot, Lane. Appreciate it. Good morning, everyone. My name is Matt Hannon. I'm the Boulder County Public Health Business and Events Liaison for offices. And so today we're going to go over just a few requirements and guidance as passed down from the state and the county as to what is safer at home as it relates to the office environment. So what is safer at home? So basically, continuing to stay at home as much as possible. There will be some businesses open with restrictions, including offices. This is new territory for most folks. And high exposure risk businesses are still not permitted. So that would be, bars and restaurants, concerts, sporting events, things along those lines where there's really a lot of person-to-person interaction. But here in the office industry, we're going to go over a little bit about what we can do. So most of you have probably heard by now, either through Governor Polis or some other outlets, that we can return to work, office work, at 50% or less capacity. Ideally, it'll be a little less than that. If you can, still have 60 or 70% of your office work from home, that would be ideal. But as long as you are at that 50% or less capacity, that's kind of been the determinant point as to where offices can return to work currently. Limiting in-person meetings and not congregating in places like break rooms or water cooler talk, that kind of thing, it would really be ideal. Ensuring proper ventilation, so that could be leaving doors open and windows open. Hopefully May's a beautiful month, so we're able to do that. And making sure that your HVAC equipment has the appropriate filters to kind of filter out any potential diseases or viruses is really important. And then conduct cleaning with increased frequency. Increased frequency is kind of a relative term. There's no exact amount you should be cleaning per CDPHE or CDC guidelines. But if you were cleaning your office, maybe once a day after work, doing it 2 or 3 times a day is suggested at this point, and we'll get into later on. Moving on to a few more little bullet points here. Placing signage around the office, so that would be around break rooms, maybe around copier areas, printer areas, just to let people know to stay 6 feet apart, continue to wear masks, do all those kind of smart things that everyone I think has been doing these past 6 weeks and will continue to do, would be really important. Assigning a coordinator is also strongly suggested. So the folks that are on this webinar, you're probably an office manager, maybe in the HR department. If you or one of your colleagues want to take on that role, you would really be the one responsible for ensuring that that signage is up, that you're communicating to your employees about all the proper protocols that should be in place. Increasing, maybe that could be in the form of emails, sending that around to folks maybe once or twice a week, just reminding them that that meetings are going to be maybe held outside, that they shouldn't be, hanging out and talking over lunch, things along those lines. Then, of course, the big thing is social distancing and wearing masks and gloves in the workplace. If you're a small office of 1 or 2 people and you're in your own separate office all day, then really wearing masks and gloves isn't as important as if you were in a office of 50 or 100 people and you're going to be passing each other in the hallways and you're in maybe a big collaborative workspace. So it's kind of, use your own judgment here, but a lot of this is still going to be required in terms of wearing masks and proper social distancing. So we have some compliance checklists that we've created. The compliance with these orders is mandatory through the health department. Use of the checklist is highly recommended, though that is voluntary. And these checklists are really kind of a compliance aid for all office environments. They can also be used as a communication tool. And I'll bring up that checklist in just a little bit, and we'll go over some of the items on that checklist. But using that, whether it's posting it in the office or perhaps sending it around via email would be, I think, highly beneficial, just so everybody's on the same page that comes into the office. And we also actually have public posters that were just recently made available, and so we'll be sending those around as well. This is really, enforcement is really kind of voluntary. We're not going to be, I'm not going to be coming into the office, to your office, nor is law enforcement, to make sure that you're staying 6 feet apart and everyone's wearing their masks. So we're really just kind of educating everybody as to what the proper protocol is. If there are issues, we may ask for the checklist. There is a complaint hotline set up, and my colleagues and I have received, a lot of complaints, hundreds and hundreds over the last few weeks. And so if we receive complaints about specific offices, we will be following up with them just to make sure that they are following these protocols and making sure that they're doing the correct guidelines. In extreme cases, civil action will be taken. It's been taken on a couple of businesses. You've probably heard on the news over the last month and a half or so, but we're really trying to avoid that and really make this more of an educational experience for everybody. So the workplace checklist, we'll kind of quickly go through here: workplaces, employees, and customers. So workplaces, make sure that workplaces are separated. That could be, it's easy to do if you're in an individual office, but if it's more of a collaborative workspace, a large open area with a lot of cubicles or open desk spaces, you want to make sure that ideally, if you're at 50% or less capacity, every other cubicle or workspace is being used. Make sure that signs are up and ventilation's increased, as I discussed earlier. Increased cleaning frequency. So really, making sure that you clean everything down, at least once a day, but then those kind of high touch areas. So that could be, coffee makers and the refrigerator door handle in the break room, the printer and copier, if there's a central location for those, any doorknobs and sinks around bathrooms or into and out of the building. You're going to really want to make sure you clean those down, I'd say at least 3 times per day. And identify a coordinator, as I mentioned earlier. That could be someone from HR, maybe an office manager would be the best candidate for that. And then increased communication. So, keeping those signs up, and then, in this kind of e-world that we live in, making sure that emails are being sent out to both employees that are working at home as well as those that are in the office, just to make sure that everyone's on the same page and are following the proper protocols. For employees, the big one, stay home if showing any symptoms. It doesn't matter if it's a COVID-19 related symptom, whether it's just a sore throat, a cough, maybe a headache, stomach's not feeling well. You should always be staying home anyway, especially in these kind of more dire times. So if an employee wants to do kind of a self-check every morning, that's fine. If you want to take their temperature when they arrive to the office, that's fine as well. But if the employee is showing any type of symptoms, then they should stay home. Also, if they develop symptoms during the day, they might show up in the morning at 8 a.m. and feel fine. By lunchtime, they're not feeling so well. They should be sent home immediately. And then obviously ensure mask and glove wearing plus social distancing. That's kind of a reoccurring theme here that we're seeing. Continue to work at home if possible. I mentioned that earlier. 50% max capacity is kind of the limit that we're going to set in offices. But if you can continue to work at home, keep that office at maybe a third capacity, that would be ideal. And then obviously no congregating. So if you have to have meetings, don't cram the main meeting room. Do that outside if possible. Continue to use Zoom or Microsoft Teams or Skype for meetings. Eat lunch at your desk. Don't all hang out in a break room if you have one. And then kind of stick to your work and stay away from others as much as possible. This is only if applicable. Obviously, a lot of folks work in offices don't have customers coming, but if you work in a law office and somebody's coming to pick up some papers, whereas normally they would walk in the front door and greet the receptionist and come into your office, have them call you when they arrive and you can go outside and meet them. Same with meetings. If they need to meet inside, or if it's pouring rain and you can't meet outside, then make sure that everyone's staying 6 feet apart, and that anyone that comes inside is wearing a mask as well. And then again, those high touch surfaces. So after somebody comes in, make sure you clean all doorknobs, anything else that they may have touched. And so that's just kind of something I'm going to continue to highlight, because those high touch surfaces are really kind of those hot spots that are really easy to transmit a disease. So before we get into any questions, we've gotten quite a few frequently asked questions. So I thought I would just kind of quickly run through a few of these just to let people know. So what are those best types of cleaning products to use, and how often should you clean? Again, there's no set guidance for frequency of cleaning, but I'd say at least 2 or 3 times a day, especially with those high touch surfaces. Best types of cleaning products are really, really hot water and soap. Those are fine to use if any surfaces are dirty. For disinfectant, I'd say diluted household bleach solutions, alcohol solutions that are at least 70% alcohol, and then EPA registered household disinfectants are also okay to use. Homemade masks, those are just fine. You do not need to use a medical grade mask, nor should you. Those should be used as safe for medical professionals at this point. So any homemade mask that you have, that you and your family have made, that you've cut out from some kind of cloth material and is washable, those are fine to wear around the office. Essential versus non-essential employees or workplaces, that is going away as of Saturday. You should all be still at home right now working through Friday. Saturday is when the safer at home order takes effect. So whether you were previously deemed as an essential versus a non-essential workplace or business, those can start to go back starting on Saturday. Obviously here in an office environment, usually it's a Monday to Friday schedule. So most of you can probably plan on returning to work, I'd say the morning of Monday, May 11th, whether you qualify as essential or not. And then do we need to allow high-risk individuals back to the office? No, if there is a high-risk individual that you feel, this could be, an older employee or somebody with pre-existing health conditions, you can require them to stay at home and work from home, providing that they're able to do so. So where to go for more information? I'm going to show you a website in just a minute here, but covid19.colorado.gov is a great one. Great state resources through Colorado Department of Public Health and the Environment, CDPHE. Boulder County, our website has a lot of that same information, just kind of more locally based. Great chambers of commerce. The Boulder Chamber has been fantastic in organizing these webinars, and they'll continue to have great information on their website as well. Your industry associations, licensing agencies, and then of course the towns or cities you work in are also passing down information that's probably been through the county and state as well. So additional questions or suggestions, a lot of questions, a lot of suggestions, a lot of concerns, complaints have been coming in. So covidbiz@bouldercounty.org is a great place to send those. You can also call, we have a call center open 8 a.m. to 6 p.m. Monday to Friday. And that's the number right there. And I'll go back to the slide as well in just a little bit. And we'll actually be hosting kind of reoccurring sessions on each of these business sectors. So retail's got one, real estate, manufacturing, and then this office sector will have a reoccurring Thursday at 4 p.m. Meetings, just kind of check-in meetings where you can ask questions and I'll provide any updated information. That's a link down there, but you can also find those links on the Boulder Chamber website, and they'll be sent out as well through a couple of different media avenues. So it's about 9:20. Before we get into the questions, I thought I'd quickly just go to a couple of resources and just show you while you're all on here. But COVID, let's see here. We will go first to the CDPHE's website. So this is their, the CDPHE website, covid19.colorado.gov. And if you see up here, there's the Safer at Home tab. You go to that, it's just got some fantastic resources. You can scroll down and actually a lot of the, it's multiple languages, and then you have your work site and employees and customers, some guidance by sector as well. So you can see the office-based businesses is on the right side. And then the Safer at Home FAQs is great. So if you scroll down the page a little bit, you'll see it's about the Safer at Home order, at-risk individuals, businesses, and it goes into all types of different questions. Childcare, education are all listed there. This is a little bit of the checklist. This is the PDF checklist that will be sent around later that I discussed a little bit earlier. So this is a checklist for office-based businesses, and you'll see a lot of what we discussed will be listed on here. So workplace requirements, and this is a great thing just for you, maybe as an office manager, HR professional to have. You have your workplace requirements, employee-related requirements, some great resources as well linked down there. So this is something that we'll be sending around in just a little bit. So heading back now to the slideshow. I think we will actually open it up from there. Again, this is covidbiz@bouldercounty.org is a great spot for to send any questions or concerns or suggestions you might have. And then from there, I think we'll probably open it up to general questions.
Great, thank you, Matt. One question that came in a couple times, and I answered it, but we will be sending this presentation along with a copy of the checklist, along with links to the resources and the contact information, and a link to signage that you can print and other resources for your business. That will go out to anybody that attends this call, as well as those individuals that attended last Thursday. In addition, it'll be posted on websites. When you order, it'll be on Boulder County Public Health. It'll be on the chambers. So we'll make sure we get this information out to you. All right, Matt, here's some questions for you. Some mask questions, but for you or Lane. We have a question as to, kind of unrelated to general offices, but a little bit of guidance on when to use masks. Do you need to wear them when you're running? What are some more guidance on that mask?
Yeah, so starting on Saturday, when the Safer at Home order takes effect, those will be required in Boulder County. If you're going out for a walk or a run and there's not too many people around you, especially, I'm actually a runner, and so I don't usually wear one when I run because it's really difficult to breathe, but I do wear one when I go for a walk. If you're on, a busy trail in Boulder on a weekend where it's packed, we certainly suggest them then, as well as they are required for entering any businesses. So that could be grocery stores, that could be going in to pick up, your takeout order or your curbside retail. Obviously, as we mentioned, in the workplace, in an office environment, if you have dozens of employees that'll be returning to work on Monday, that's when masks should all be required.
Okay, one participant said that the Boulder County website does not state.
I want to just add one more thing. Sorry, I was muted. Yeah, for the masks, they're required anytime you're in public and you can't maintain social distancing. The one caveat is if it would impact your health. So they're not required if somebody has certain respiratory conditions. If you're doing an activity where the mask is going to restrict your breathing and cause a health concern, that would be the times. But again, you should be trying to maintain the social distancing if you can't wear a mask.
Okay, and then within offices, there are, within the checklist, a requirement for masks when you're interacting with the public, correct?
Interacting with the public or each other, if you can't maintain those social distancing. If you're a sole person in your office, you wouldn't need to wear a mask by yourself.
Okay. This face covering order expires on 5/26, but should we count on this being extended?
It's tough to say for now. I'd say obviously it's going to be in place through 5/26, and it's really a matter of what the numbers look like. If infections continue to rise, hospitalizations continue to rise, then you can probably expect that it will be extended. But if people are kind of following the guidelines and protocols, and they're wearing their masks and they're social distancing, and they're staying at home as much as possible, and those numbers go down, then there could be changes. So it's a little too early to tell, but it really depends on what the epidemiologists say and what the state health department says.
Okay. To extend on this theme a little bit, are employers required to provide masks and gloves?
Yes. Any items that are required of your staff need to be provided by the employer.
A question about the temperature checks. Are we going to be required to check temperatures, or have office members sign a waiver that they check them at home? We're a co-working space, so people coming into the office are not employees of ours.
Yeah, so a lot of larger businesses with hundreds of employees are doing temperature checks and will be implementing check-in stations prior to entering work in the morning. But I believe that as of now, employees can self-check in the morning. So wake up and take your own temperature, check for symptoms, and then report to work. Just maybe a quick email saying, hey, healthy, good to go. See you in 30 minutes. So it is not required that you need to have your temperature taken upon arrival at work, but self-checking at home is allowable.
And I just want to clarify that a waiver would need to be very clear that it's not a waiver of those requirements. They just need to have done this at home. So you can have a system like Matt said, where they're doing it at home, but there's not a waiver of this condition. So not waiving that they don't feel they need to do it. So just to be clear, when we talk about waivers, usually that means it's an exemption from the requirement, and that's not what this would be.
Okay. If you have a 6-foot distance in the office, then are masks still required?
Yes, and like Lane said, masks are required unless if you cannot keep that 6-foot distance. But if you are in an office of 2 or 3 people and it's a 1,000 square foot office, then you don't really need to wear them. But even if you're a pretty crowded office, 50% capacity, you're still going to be passing people. Even if you're sitting 6 feet away, you'll be walking by people in the hallways. So mask would still be required then. If you're sitting at your desk for an hour and nobody's within that 6-foot radius, then you can take it off. But if you're saying you're getting up and heading to get your lunch, you'll be walking by people within 6 feet, then you should be wearing masks.
Great. This question says, my architectural office has 4 people, including me. I assume all the content so far applies to small offices as well, including the 50% rule, masks, temperature checks, and all of that. Can you address if there's any guidelines for small offices, if any?
No, small offices still fall under the same guidelines. It's a little bit easier if you're a small office to maybe work at home or to, keep that social distancing. If there's, only 4 of you and 2 of you are in the office at the same time, obviously you can be more than 6 feet apart, not have to wear masks, maybe not have to disinfect or clean, high touch service areas down quite as much as an office with, say, 50 or 70 people in there. But these general requirements should still pertain to small offices.
Okay. This might be a question for Lane, but any chance the stay-at-home order will be continued past Friday?
I think there's always chances. We have no information at this point that things are going to change. So we're very prepared to move to this next phase. Again, the virus seems to always be giving us different information. We are already expected to see increases in cases because throughout the state there has been increased testing. So we certainly knew that would be a component of increasing our testing, which is a critical part of our ongoing plan. But no, we don't have any plans right now that we're going to be going back to this or staying in the stay-at-home order. Again, there's always the possibility that things could change, but as of right now, that's not what we're seeing.
Okay. When should gloves be worn in an office setting?
Yes, that's a good question. Gloves are one of those things that obviously, in the food service industry, you should be worn all the time. Offices, if you are just sitting at your desk in an office, it can be kind of annoying to wear gloves and type. I understand that, so that's not really necessary. But if you are going into the break room, let's say, and opening the fridge and using the faucet or the microwave, that would be a good idea to wear gloves. If you're going to be going anywhere into those high touched areas, touching any doorknobs, that kind of thing. So I'd say if you're leaving your exact kind of close office environment with just your computer and your phone, and going anywhere where other people might be touching things, then that's where I would suggest wearing those gloves.
Okay. We have a question about bathrooms. Do you have a recommendation on how many should use the restroom at once if you only have one restroom for 150 employees with 4 stalls? Maybe just some guidance on bathrooms.
Yeah, so that's kind of a tricky one. Obviously, if you only have one bathroom for that many people, I'd say, clean it more than that 2 or 3 times that I suggested earlier. That would be one of those things where you should really probably only have, maybe 1 or 2 people in there max at a time. And then really, After every time an employee goes in there, they should probably wipe down the urinal or the seats, the faucets, the doorknob. Yeah, that's just one of those tricky situations where you really need to be diligent and really need to be disinfecting surfaces as much as possible.
We've gotten this question for other industries as well. Some have asked, should they shut down certain stalls, or just they can keep them open as long as they're cleaned?
I think you really want to keep the social distancing. So, you know, depending on the size of the bathroom, if it normally has 10 stalls, but obviously 10 people would not really allow you to keep that social distancing. There's only 2 hand sinks. Maybe it's, you know, you really need to be able to keep the 6-foot separation at all times. So that's the goal. So it's hard to give any specific answers without seeing bathrooms, but I think you're going to need ways to ensure that it's ideally a single person at a time. But again, for really large volumes of people, that may not still be possible, but you certainly don't want to have those be a crowded area where people are able to congregate.
One person said, I heard that it's mandatory for offices with more than 25 employees to take temperatures of employees as they come into the office. Is this required? Is this accurate? What are those levels?
I've seen a couple of really large businesses do that. GBS, I know, has been on the news a lot as well. They're doing that. So they got quite a bit of media attention. I know a couple of other larger businesses are, but I haven't seen anything that specifically says a business of 25 or larger or 50 or larger needs to have those in place. But I have been working with a couple of larger companies that are really in the 300, 400, 500 employee range that understand how important this is and are implementing kind of a check-in before entering the building that are implementing that. So if you're an office of 25 or 50 or 75, it's not necessary as far as I'm aware, but still doing those morning checks is a really good idea, and this should be undertaken.
So yeah, actually the state does require for businesses with 25 or greater that they need to do that checking. If it's a smaller office, you can have that home daily check before they come, but for those larger businesses, they have to do that. And there's some guidance on, and we'll have that in our piece on the symptom tracker and how to conduct those screenings. So there's some resources for that.
No, thank you, Lane. Yeah, thank you for the correction.
Yep.
More frequent cleaning is great, but where do you get the cleaning supplies? And I know, Lane, last week you gave a little bit of insight as to creating your own cleaning supplies, but a little insight on where to buy cleaning supplies. And this, as you know, will lead to a question of where do I get PPE?
Yeah, so we're putting together information on certain resources. For cleaning, you're really just looking at soap and water, like Matt said. That's how you clean. For disinfection and sanitizing, that's, those are different options. You can use a bleach solution, which you can make. You can buy bleach, and then there's directions on how you dilute that to the proper concentration to get the levels that they'll be effective. But yeah, if you're looking at trying to buy Purell and things like that, or sanitizer wipes, those are going to be a lot more difficult to obtain. But you do have to have those products. So if you're not able to get them and you can't follow the different requirements, you won't be able to operate. And it will be a challenge. I know that's been one of the big concerns with moving to this focus. Now we have all these different folks competing for the same products. So it will be potentially a challenge, but we are looking at trying to identify mask resources. There's a lot of guidance on how to make those masks. There are folks that are doing mask drives within Boulder County that are just making and donating masks. So we're going to try to do our best to provide you the links to those different resources.
Okay. So we have a question about someone also has an office in Denver. Should we expect each municipality to create their own requirements?
You do need to look at where you're at. From what I know, there's pretty strong consistency, and these requirements that we're sharing are the state requirements, which are in effect everywhere. But if you're in Denver, you really should just double check to make sure there aren't any additional requirements. Their mask order went into place prior to the Boulder County one. So again, just make sure that you're checking on those. but for the most part, the state requirements should be the consistent requirements everywhere. What we've really done is give you additional resources. We didn't put any additional requirements. We're giving you best practices and resources. So as Matt talked about in our checklists, that hopefully gives you a lot of guidance on how to do things and where do I find more information.
Okay, so we have a question as to whether, is there a possibility that COVID will have a second round during flu season and that the moving back to a stay-at-home order will occur?
Yeah, I think that that's definitely a possibility, but that's something we're trying to avoid at all costs, which is why all of these kind of what a lot of people consider to be extreme measures with social distancing and staying at home orders and wearing masks out in public. There's obviously very good reason that we're implementing all these measures, and it's to try to avoid having that happen a number of months down the road. So as long as everyone's keeping their distance and being as safe as they can, continue to stay at home when they can, will lessen that chance. But I don't think that it'd be appropriate to say that there's no chance of that happening come next fall.
So Lane, I think this question's for you. Where is the language order on 25 plus employee temperature testing at the state level? And could you provide a link to that? And
Yeah. And I think Matt had already shown you, if you go to the state's page, that covid19.colorado.gov, and go to any of the different sectors that are listed there, and Matt kind of navigated that for you. You can go to the office-based businesses, and it has all the different requirements on that page. And it talks about under practices and employees, it says conduct daily temperature checks and monitor symptoms in employees for businesses with 25 employees or greater. And then smaller businesses can ask employees to do self-temperature and symptom checks at home. And then it gives you a reference document for the symptom checker. So that's it's all on that state site, the covid19.colorado.gov.
And I would add to that, I would suggest checking that site at least once a week, because information on that site changes rapidly. Obviously, this is still hour to hour, day to day. New information comes in regarding the virus. And so checking that website has the most up-to-date information, because something you read today maybe wasn't there a week ago, and in a week there might be new information on there. So checking that at least once or twice, maybe 3 times a week for the most up-to-date information would be advisable.
And if there's any changes to orders, which again, we aren't expecting, we'll make sure to work with the chamber to blast out if there were new requirements. But as Matt said, there's lots of new resources that are added there, which are helpful. But again, for specific requirements, if anything changes, we will make sure. And Matt's going to be hosting weekly calls. Absolutely, at that time, we would highlight anything that if there was some kind of change in the orders.
So speaking of temperatures, what temperature is too high to come to work, and maybe a little bit of the inconsistency, of the temperature taking when it's hot outside, but what temperature is too high?
100.4 is the number that we're specifically looking at. And it's, again, that symptom tracker will help you with a lot of that information. It'll help walk through that. As we head into the summer, if you're taking people's temperatures, it may be something where you need to check people a couple times if they've been outside. If it's a really hot day, they may have warmed up a little bit as they were heading to work. So those are things that you can do, and it gives some guidance in there. But that's sort of at least the initial temperature that would be considered an elevated temperature.
All right, one more question about temperature checks. Can you share a best practice on who should be designated to check employee temperatures? I suspect there are individuals that may feel uncomfortable with this duty.
That's going to be pretty office specific of who do you feel can do that. Obviously, that person needs to be wearing that mask, face covering, and then again, the symptom tracker really walks you through how to do that. So after you've watched that might help you identify within your office space who's the best person to do that. Ideally, you don't want to be handing thermometers to each staff person. Otherwise, you're going to have to clean and disinfect them between each individual person's use. So again, there's infrared thermometers that you can use to take that person's temperature, which doesn't require like an oral thermometer to be shared amongst employees. That would not be a best practice. So again, looking at that guidance will help you understand what you're looking to do and what equipment you're going to need to acquire. And that again will probably be a challenge.
And again, we'll be sending out the checklist along with links to resources, the symptom tracker, all of that is in the checklist, and then signs and so forth will be sent out to you just following this, this webinar. So we have one more question about the 25 employees. We have more than 25 employees. However, if we bring back 50% of our office, we'll have less. Do we still have to do temperature checks? Is it based on the number in the office or how big the organization is?
That's a good question. My thought would be this is how many people are congregating, but we'll help clarify that question.
Great.
So if you have less than 25 actually that are reporting there to that site, I think that's really what we're focused on. If you have 100 employees that are all working at home, taking their temperatures isn't something that's even needed. So because you already are doing that virtual work. But we'll try and clarify that.
Great. Until now, I had not seen anywhere that employer needs to provide masks for employees. Is that really fully accurate? What if we require employees to bring masks, or can employees bring their own masks?
They can bring their own, but you cannot require them to bring their own. So this kind of goes back to OSHA and all other requirements that if there's any safety equipment needed for an employee to do their work, the employer must provide it. And so these are things that are all being required per the law. These are state orders, so these are laws. And therefore, the employer must provide those to the employees. So you may not find it called out specifically within the Safer at Home, but it's more that default where if an employee needs something to be protected in their work, the employer must provide it.
All right, a question about break rooms. Wouldn't it be sufficient to just wash hands or use sanitizer after being in the break room instead of wearing gloves and risking cross-contamination back to other areas of the office or the employee's desk with gloves?
Yes, we're actually getting a bit of clarity from our legal team about break rooms, and there will be some more information forthcoming about that because there's been a little bit of mixed messaging in terms of if break rooms can even be open in some places with a certain amount of employees. But the general guidance for break rooms that I've read still says that if you wear gloves, that's still best practice. But really just wiping down those high touch surfaces. So that would be the fridge door, that would be the sink faucet. That would be the coffee maker and the microwave, and obviously just not congregating in there. So not sitting down with 3 or 4 people at a table and chatting like maybe you normally would over lunch. So break rooms, there will be a little bit more clarity forthcoming. But as I mentioned, those best practices would still be to wear gloves and to just wipe down and disinfect as much as possible.
And potentially take the gloves off after leaving the break room so you're not cross-contaminating?
Correct, yeah.
And so proper glove use does include washing your hands before you put on gloves. If you've contaminated those gloves, taking them off and washing your hands before you put on new gloves. So that all is encompassed with wearing gloves. Gloves are definitely not a magic tool that allows you to touch things and not spread contamination.
All right. So we have a couple questions about what's the responsibility of landlords or property management companies, especially when you're have common use areas like restrooms, or if you're in a small office building.
I don't know if we can answer that question fully. I mean, whoever is responsible for the building maintenance is the one who should be doing the cleaning. So again, if you're leasing a space, but you don't have those responsibilities as part of your lease, then ideally that landlord needs to be doing all the cleaning for bathrooms and things like that. So, but I don't know if we can give you just a general answer on every specific instance there, but these things need to happen. And so whoever's kind of in control of that building and has those responsibilities needs to take them on.
Yeah, like Lane said, every building and every workspace is a little different. So my understanding is that landlords, as Lane mentioned, should really be taking care of kind of that common area. If there's, one common break room or hallway and a number of offices kind of shoot out from there. But businesses should be taking it upon themselves. Obviously, whether you're leased or owned doesn't matter, but if you're in your office space, you should be cleaning down all of those surface areas. And then working with your landlord and communicating properly to make sure that everything else is being covered.
Great. And Stephanie, Yes, I did see this question. So we'll ask this question. I'm just trying to get in specific orders, but how long do you think we'll be operating at a 50% reduction of staff?
So that's kind of a tough one to answer. Obviously, the order kind of goes through the end of May at the moment, so you can expect at least till I believe May 26th, if not a little longer. Those requirements, the mask requirements, all that really depends again on the numbers that come in involving the virus and contamination rates and hospitalization rates, infection rates. So yeah, it's tough to say, but you'll plan for at least the foreseeable future.
I know one of the things that we're going to work with the chamber to do is, and probably on some of the weekly calls, is try to find out how effective the various components of these orders are. What are you seeing? This may not be for your sector as much, but certainly retail. Are they seeing the clients come in? Are they wearing masks? Are they doing a good job of keeping that social distancing? Those types of things, we're really looking at the effectiveness of how well things are being implemented, so that as we go back and look at our epidemiological surveillance, does it help justify, hey, looks like it's very effective and our numbers are where we would hope they are. If our numbers are really bad and we're hearing there's very poor effectiveness, all those things play into helping us make decisions. So the more effective these things are implemented, the better chance that our disease will not spread to levels that start to make us potentially have to go backwards. But these are all best projections. And as Matt said, we're certainly anticipating likely through May 26th. But again, it's all going to be based on the surveillance efforts. And then again, the effectiveness of the implementation.
And the weekly calls that Lane's talking about, when you get your email, they will be every week for office. So we'll have a designated time, and at some point we'll make sure if we're going to be talking about this particular topic, or if we have somebody else coming in, or if there's any best practices shared. So those are all set up, and they will be Thursdays. Oh, yep, Thursdays at 4 o'clock, starting next week. So we will we'll send that out, and you'll have access to regular question and answer sessions with Boulder County Public Health, with industry leaders, and so forth. Okay, we have a couple more questions. In regards to restrooms, not restaurants, shouldn't the responsibility be placed on the people using them to social distance? This does not seem like it should be employers' responsibility.
Yeah, I think you need to just be able to communicate to folks, have ways to know, the bathrooms are occupied. I think it is incumbent on the office to make sure they've set things up for people to be successful. That absolutely your employees play a huge role in this being effective. They need to social distance. They need to do a lot of the steps that are outlined here. So it's a dual effort. Everyone needs to work together on this, and you need to figure out the best way to accommodate having bathrooms that are not areas where there's a lot of people congregating and having that risk. There's a lot of safeguards when you look at all the different pieces. It starts with making sure you've done a good job of screening not to have sick employees at work, social distancing, wearing masks. So there's lots of layers to try to prevent disease spread, but anyone that is a breakdown starts to increase the risk. So it is important that everybody be part of this.
And that goes back to the 50% office capacity. If you're, only have, that one bathroom or two bathrooms for, 100 plus employees, and that's at that 50% capacity, then you might have to bring it down to 25% capacity for the next few weeks, and continue to have employees work from home. If there's that issue with that only one bathroom being available for, X amount of employees.
Okay, and one of the signs you'll receive in the package of signs that will go out includes, stay 6 feet apart, how to wash your hands, all of those things that you can put up to help in your education efforts. And one question, are coffee filters and fabric masks really helpful? This seems to be different information and no authority on the best fabric mask.
Yeah, I mean, when you're looking at things that are not respirators and surgical masks, there's obviously a huge spectrum of what that mask is and what it's made out of and all that stuff. So they are effective at knocking down droplets, and that's really what we're focused on. They are not a respirator. They don't filter the air that you're breathing to protect you, but they're really to protect everyone else from you. And so that's really the point of masks, is to knock down those droplets, and this is spread by those droplets. So there is an additional effectiveness of having this step. It doesn't solve everything. It doesn't 100% protect people. But it's, again, one of the tools that we're looking to put in place along with all these other requirements. So it's a layered effort.
Okay, we have 3 more questions, and then we're gonna wrap up. Regarding the masks that the employer provides, if they're providing a mask, and especially the disposable daily ones, should the employer provide the surgical mask 1 per day or a mask 1 per day so they're not being reused?
No, you shouldn't be providing surgical masks at all. Those are not what we're requiring for office spaces. And you're going to just, first of all, have a very difficult time getting them. And then you're going to get to a place where you're going to compromise that supply for healthcare systems. Again, I think ideally masks that can be laundered are the ideal. So those do-it-yourself home masks, CDC has great link on how to make those masks. And then people can launder them and bring that mask back to work. That would be the ideal. If you go a disposable route, you're going to have probably challenges finding supplies because you're likely looking at surgical masks and things like that. So I think ideally getting masks that can be laundered and then having staff launder those on their own and bringing them back would be, I think, ideal. But you can't just make them go find masks and make them themselves. So
there are a couple local companies that have switched to mask making, Boulder companies, Erie companies, and we'll make sure that those are added to the resource list. 2 more questions, one quick one. Are tissues and sanitizer required to be provided in the office?
I wouldn't say they're required, but they are highly encouraged. That kind of goes with the cleaning products. You should really have kind of a wide plethora of cleaning products available, hand sanitizers available, tissues. Yeah, that's another good idea. But although obviously if somebody's sick and needs to use tissues, they shouldn't be in the office in the first place. So to have all that on hand, would be ideal.
Okay, and one last.
I don't recall seeing tissues called out anywhere. I think that's probably something you typically do provide at your office spaces. I don't know if you don't. Certainly it's allergy season, so you're going to have other non-COVID related similar symptoms that do not make people need to be at home. So if people are sneezing because of allergies, that's not a reason to exclude them. But I didn't see anything in there that required providing tissues.
One last question, and I just wanted to ask it. Are special events like cycling events, running events, various group events that a company sponsors going to be allowed in the coming months? I realize this is a big step in discussing in terms of more aggressive social distancing in effect now, but curious what your prediction may be for the near future.
Yeah, I think we're pretty cautious not to try to make predictions. Certainly in this phase, no gatherings over 10 people are going to be allowed. I think that's then potentially in those next phases, will there be gatherings allowed up to 50? But anything that's going to really congregate people is probably still going to be something that's unlikely. But again, we're really just not sure at this point.
Seeing as we don't have any more questions, I'm going to thank you both, and Jesse, who's not been on, but thank Boulder County Public Health for providing this resource today, for answering questions. And I want to thank everybody that attended to learn a little bit more about how to reopen safely in the coming weeks. As I said on the webinar, you'll receive an email in the next hour or 2 that has a copy of this webinar, the checklist, access to signs and resources, as well as other resources you may need, contact information, anything that you might need to ask those questions in the future. And we hope to see you at our weekly call on Thursdays at 4 o'clock. Again, these will be just opportunities to ask more questions and receive more information. I hope everybody has a wonderful day, and we'll see you next time.
Thank you all.
Thank you.